Having a newborn is a very exciting time, but it also can be very intimidating. Like I said earlier in the show, my daughter may be 1, but it was a blur already. Well, doctors Jen Arnold and Rachel Dawkins are here from Johns Hopkins All Children's Hospital to help guide us through some of the most popular questions and issues you receive. Welcome back. Welcome.
Thank you.
Glad to see both of you. And first, let's start out because I know we've got a lot we want to talk about. Let's talk about the big ones when it comes to eating, sleeping, and pooing as well.
Yes, the things that babies do and parents have a lot of questions about.
Oh, yes. I would say, where were you a year ago when I needed you, Dr. Jen? We are glad you're here now. So let's talk about the eating, because I know that that's a big issue. How much? Am I doing it right?
So it's probably the most common question we get questions about. So of course, breastfeeding is best, and that's what we recommend. But if parents can't breastfeed for whatever reason, then formula is a safe and good alternative. And my rule of thumb is to just let the baby feed what they want within reason. So I would say try not to overfeed your baby, and my rule is the number of months they are plus 1 is the max number of ounces they should take at a feed. So if your baby's 2 months old, then 3 ounces is probably sufficient for a feed every 2 or 3 hours.
That's a really good rule of thumb. I like those kind of concrete
rules. It's easy to remember.
Yes. That's a very good one. And I know there's also a lot of questions. You think eating, and then you swear it comes straight out in those newborn days.
Yes.
So let's go to the other popular topic for parents.
Yeah, so poop. I mean, this is probably every question of every new parent is, how often should my baby poop? What should it look like? What if it's green and not yellow? And it's okay for babies not to poop every day, and it's okay for them to poop multiple times a day as long as it comes out soft, seedy, gross. That's kind of normal. And it can be yellow, green, brown, as long as it's not white or black, except in the first couple of days, or with blood in it. Normal.
Okay, my daughter probably would kill me if she was older. She's a carrot eater, so we have a lot of orange.
Yes, orange is okay.
Orange is okay. Again, glad she's young and she doesn't hear me asking these questions yet. And the other big one, and this is something I still stress about, even though I have a 1-year-old now, the sleeping thing. I am so petrified of doing something wrong because it's such a scary thing for parents.
Well, exactly right. Every parent always worries about their child, their infant, when they're sleeping. You're thinking, okay, is it okay? They're worried about sudden infant death syndrome.
Yes.
We're all very worried about anything going wrong. So I think it's really important for parents to know what's normal and what's not normal and what is safe sleep. So safe sleep first and foremost. No bumpers, no stuffed animals, no extra bedding in the bed, just a fitted sheet and your baby in their clothes on their back to sleep. So those are the things that we know can help to prevent SIDS, and that's critical for every parent to know, I think.
And the 2 questions with that, for how long? How long is that only fitted sheet, only parents?
They say the highest risk of sudden infant death is about 12 months or younger. So, I would say definitely for that first year of life. But even going beyond that, I don't know, it can't hurt. Safety first. So SIDS can happen up to, about 18 months or so.
And I'm glad to hear you say it, because I've been kind of panicked with these cold temperatures, and I talked about in the earlier part of the show to put a blanket on to keep her warm as these temperatures are cold. How do you know if it's the right time to do that? Again, what are your thoughts? Do you tell parents who are worried about temperature?
I usually say have them wear to bed whatever you would wear to bed, and maybe 1 extra layer. Okay. Kids usually lose heat from their head, so you can put a hat on them and
like our baby
little
here.
Mannequin.
Yep.
And I also tell parents, put them to their back, but if they're old enough that they can flip themselves over, then that's okay. You don't need to wake them up to flip them back over.
Yes, that's a good point, because a lot of us worry as they start to move around.
And one of the things that I worried about going back into, when Alex, before she turned 1, she'd always want to sleep on her side. And as a parent, I'm like, no, she's supposed to sleep on her back. What do I do? Do you just let them go to sleep on their side, or do you really try to, you say don't wake them up?
Well, once they're moving around on their own, it's okay, because that means they're strong enough to also move themselves back if they were to get into trouble. And so a lot of that positioning is because babies aren't strong enough to move themselves if they get into a situation where it's difficult for them to breathe.
And when do you know if it's difficult to breathe? I know breathing patterns is something that we brought our friend back here as well.
Yeah, so we brought our baby here to demonstrate. So a lot of times in the newborn period, and actually even it could happen up to about 12 months of age, a year, babies will have a normal breathing pattern that looks a little abnormal and scary to parents. It's called periodic breathing.
Okay.
All it is that means the baby's breathing at a relatively normal to fast pace, but then they'll have a pause in their breathing, and that pause can last up to 10 seconds and still be normal. And so you can see on our baby here, she's demonstrating, or he, I don't know, we got a blue cap on, but we'll call her Tori for now. You can see the breathing pattern is normal, and then all of a sudden you'll see a pause in the breathing to where the baby's not breathing for about 10 seconds. Now, if it's longer than 10 seconds, or the baby's turning blue, or looks like when they are breathing, they're struggling to breathe, that's a sign that something's not right and you need to seek medical attention.
Oh, I am so glad you're sharing this information. That 10-second thing could be very, very scary. And now if that 10 seconds does increase or they turn blue, as you say, CPR. Can we have a refresher?
Absolutely. You want to learn?
Oh, we have 30 seconds. We have 30 seconds, Dr. Jen.
Okay. All right. So when a baby, if you notice your baby's blue or not breathing, first you want to do is tap their foot, make sure they're not responsive. And if your baby's not responsive, then you want to call for someone to call for help while you start CPR. And so you start with chest compressions. So you've got your hands in a good position. You want to encircle the back. You want to be on a flat surface, ideally the floor, but it's something that's hard. And then you want to use your thumbs 1 inch below the nipple line. And then you want to go up and down at the rate of essentially the song Staying Alive. So you can do 30 chest compressions and then 2 breaths. So so hard and fast, staying alive, bum, 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 staying alive.
I'm breaking out in a sweat, but you say that that's one of the misconceptions is you don't go hard enough, and I'm getting a really strong rap from my producer right now, so we have got to go. Thank you.
Well, thank you for
Good
having
stuff.
us.
New moms, you will survive. If I can do it, anybody can do it. Thank you again for your time.
Oh, thanks for having us.